Next, let's talk about how does a cholesteatoma originate and what are the theories behind it. So there are a lot of theories behind it. We'll first start with number one, which explains how a congenital cholesteatoma forms, and that is because of the presence of embryonic epidermal cell rests, which are basically keratinizing epithelium entrapped in the middle ear cleft or the temporal bone. Usually, these embryonic epidermal cell rests disappear over time, but if it ends up persisting, it can lead to the development of congenital cholesteatoma. Now, we'll discuss four different theories which will describe acquired cholesteatoma. And I'll also talk about what are the different types of cholesteatoma right after this. So, first, let's talk about the theories. The first one is Wittmack's theory, also known as the invagination theory. Here, what happens is there is an invagination of the tympanic membrane from either the attic or the posterior superior part of pars tensa, and this occurs in the form of a retraction pocket. If you see in the image over here, you can see this is forming a retraction pocket over here. And why does this begin? This begins because of any kind of eustachian tube dysfunction. So whenever there is an eustachian tube dysfunction, it leads to the formation of negative middle ear pressure. And when there is negative middle ear pressure, it leads to invagination of the tympanic membrane, leading to a retraction pocket. Now, once the retraction pocket forms, the outer surface of the tympanic membrane is lined with stratified squamous epithelium. So, this layer, after invagination, it starts to form the matrix layer of the cholesteatoma and it starts laying down keratin in the pocket. So, that's how it starts to form the retraction pocket. Now, as the retraction pocket keeps deepening because of the persistent negative middle ear pressure and repeated inflammation, now, desquamated keratin cannot be cleared anymore from the recess. So, basically, this retraction pocket loses its self-cleaning capacity. And the moment it loses its self-cleaning capacity, it lays down a layer of keratin inside and leads to the formation of cholesteatoma. Now, bacteria can end up infecting the keratin matrix and form biofilms, resulting in chronic infection and epithelial proliferation. So, this is basically Wittmack's invagination theory, which starts from the fact that there is a eustachian tube dysfunction, which leads to a negative middle ear pressure, which leads to the formation of a retraction pocket either in the attic or in the posterior superior part of pars tensa. Now, the outer layer of the tympanic membrane, which is lined by keratinizing squamous epithelium, it starts forming the matrix of the cholesteatoma and lays down the keratin in the pocket. Now, as the negative pressure continues to persist, it leads to formation of more desquamated keratin inside, and the retraction pocket ends up losing its self-cleaning capacity, leading to the formation of cholesteatoma. Okay, that's all about this. Next is Ruedi's theory, which is also known as the basal cell hyperplasia theory. Here, what happens is, under the influence of an infection, the basal cells of the germinal layer of skin can proliferate and start laying down keratinizing squamous epithelium. See in the image over here, there is an epithelial cone being formed, which starts to lay down keratinizing squamous epithelium. Now, the prickle epithelial cells of pars flaccida can end up invading the subepithelial tissue by means of proliferating columns of epithelial cells. This will lead to basal lamina disruption, ultimately leading to epithelial cone invasion into the subepithelial connective tissue, and this will result in the formation of microcholesteatoma. These microcholesteatoma will now enlarge and perforate an intact tympanic membrane, leading to the formation of a cholesteatoma. So this is basically starting from an infection which leads to hyperplasia of the basal cells of the germinal layer of skin. This is about Ruedi's theory. Next theory is Habermann's theory, also known as epithelial invasion theory or migration theory. Now, here the starting point is there is already a pre existing tympanic membrane perforation, and usually this is of the marginal type. Now, what is marginal type? The marginal type is where basically the annulus tympanicus has been destroyed. So what happens here is the keratinizing squamous epithelium, which is the outer layer of the tympanic membrane or even the external auditory canal, it starts to migrate into the middle ear through this pre-existing perforation. If you see in the image over here, there is a pre-existing perforation right here in the attic. Now through this attic, either the outer layer of the tympanic membrane or the lining of the external auditory canal starts to migrate towards the middle ear. And damaged inner mucosal lining of the tympanic membrane allows this keratinizing squamous epithelium to migrate inward and leading to the development of cholesteatoma. We have seen that cholesteatoma which arise after temporal bone fracture more commonly follow this theory. So this is known as the epithelial invasion theory, where we already have a pre-existing perforation. Now the last theory is Sade's theory, also known as the squamous metaplasia theory. Here basically we have come across a lot of times where we have seen that respiratory epithelium it can undergo a lot of metaplastic changes in different other parts of the body in the lungs. That same thing can happen here, where the middle ear mucosa, like respiratory mucosa elsewhere, it also starts to undergo metaplasia due to repeated infections, and it starts transforming into squamous epithelium. So these are all the theories behind the origin of cholesteatoma. Now, it might be a little difficult for you to remember sometimes what are the names of the theories exactly. So I have a small mnemonic that can help you with it. So the mnemonic is real big ears make echoes. So the first letter of each of the 5 words will make you remember the theories. So with R comes retraction pocket, which is the Wittmack's theory. B is for basal cell hyperplasia, which is Ruedi's theory. E is for epithelial migration, which is Habermann's theory. And M is for metaplasia, which is Sade's theory. And last is embryonic cell rests, which is basically the cause behind congenital cholesteatoma. So this is a mnemonic that will help you remember all the theories behind origin of cholesteatoma.